Hi, I'm Naomi Allen, and I'm joined today in our clinic in Lake Success, New York, by Dr. Nikhil Nadkarni, who is Brightline's Chief Medical Officer, and Dr. Caroline Mendel, who is Brightline's Regional Clinic Director. And we're so thrilled to be with you. I wanted to just share a little bit about my personal story, why I founded Brightline in the end of 2019. I have three kids, and my youngest had gone through a crisis when he was 5 years old. And we were that family that really struggled to figure out a diagnosis for my son. I was on wait lists for so many months with therapists and psychiatrists. We were trying to figure out where to go and what to do, and I just was lost.
I have seen a lot of families that really struggle, not just with the symptoms of the illness that they're dealing with, but also just navigating the system itself to get there. And I think that's in some cases just as difficult as dealing with the symptoms themselves.
With mental health, it is so much more complicated. We have all sorts of different environmental factors and biological factors, and there are different specialists, and it can be very complicated to know who to go to and what kind of support your child needs. It can be, quite challenging and confusing for families and for us too.
Caroline, I remember when we were just first starting down the journey with our son, I felt like I was having to not just try to figure out what type of care he needed, but also try to keep his pediatrician informed, his schools informed. We weren't getting support from his school. Can you talk about that burden for families and how does Brightline help?
Yeah, so parents are often in that position of having to be advocates for their kids. And at Brightline, we want our therapists to help parents be those advocates, right? We want to help be that glue, provide information to the pediatrician, or speak to the school directly, or coach parents to be able to say, here's what my kid needs. Because if I see a kid in my office for 45 minutes in the week, that does not compare to the hundreds of hours that they're spending outside in the real world. So if I'm going to be doing an effective job as a therapist, I need to make sure that the parents know what to do, that the teachers know what to do, that the soccer coach knows what to do.
One of the things that I really struggled with when we were finally able to get my son in treatment, which by the way took months, I felt like I was flying blind. I had no idea how his treatment was progressing, how long it was going to be, um, kind of what were the benchmarks or milestones of success. And that was really scary as a mom. I was the person going to all the effort to get him to his appointments, but I wasn't the one receiving the treatment. And so I couldn't really tell if it was working. And so how do we think about measurement-based care at Brightlight, and what role does that play in care for kids and families?
When somebody comes in, we identify a diagnosis, we identify the level of severity of their symptoms, and then if we don't have a way of tracking how those symptoms are improving or how those symptoms are responding to treatments, then we don't really have a way of understanding the progression that the kid is going through. And that means that it's hard for families or for parents like yourself to even understand what's going on. And this is already such a complicated situation. But if you have measurement-based care being a central part of a central pillar of the care that you're providing, not only do you establish a baseline of I understand what the severity is from the very beginning, but then it's so illuminating as a parent to be able to see, okay, this is what the numbers were in the beginning, and now we're starting to see some progress.
I remember when we first were seeking treatment for my son, and someone said, "Oh, you need PMT, parent management training." And I thought, that is the weirdest thing I've ever heard. Why do I need to learn how to be managed as a parent? I didn't realize that there were clinically proven programs for families that have really young kids. I always thought that therapy wasn't really until kids were 12 or 13 or teenagers. So what is PMT, and when do we use it, and how does that look?
Yeah, it's one of the treatments that I deliver most often, actually. It is work that we do with parents. It's considered a parent-mediated treatment. If you are a parent who's struggling with a child who is engaging in tantrums or not listening, we want to make sure that we're equipping the parents with skills to be able to handle those behaviors. We also can teach parents different communication skills, so being able to validate their kids' feelings and be able to connect with them emotionally, kind of transferring all of the skills that we use as therapists, but to the parents so that we can work ourselves out of a job in that sense.
And I think it's really important to talk about when you use evidence-based care in conjunction with measurement, that you're not trying to keep the kid in therapy forever or psychiatry forever, right? That you really are using the guidelines and the evidence to tell you, okay, maybe this child should go out and just practice his skills.
We certainly want to be giving parents and kids the skills to be able to do things on their own. From my perspective, if a child loves to go play soccer, right? I'd rather have them out on the soccer field engaging in that after school activity than coming to see me. Parents are worried about like, oh, if I enter into this, that's it. Like we're doing this thing now. And that doesn't have to be the case. We can, give you the skills, see certain improvements, and then let you go back to living your life.
Yeah, and I think that kind of goes in contrast to what I see in the community a lot, which is not evidence-based care in both therapy and psychiatry. So I've seen so many parents that come in and say, "Well, my kid's been in therapy for 3 or 4 years, but nothing has really changed, and I haven't really noticed anything different, but we've been doing the work."
And Caroline, it's really interesting to me as we've met a lot of therapists or interviewed them and brought them into the Brightline fold that it's not common for therapists to see multiple family members. But at Brightline, we can see a whole family because we have different clinicians that can meet different family members' needs with different skills and capabilities. Can you talk about how that's different than the model that clinicians might have in private practice?
Sure. Yeah. We certainly want to respect that kids have their therapist, their space, and so that's like exactly like what you're saying. If parents are coming in and they want multiple kids seen because mental health disorders often run in families, and it is pretty common that multiple kids may be experiencing challenges. We're able to assign them different therapists. That way, they each have their own space, but the parent is able to say, okay, this is the place that I'm going, and all of my needs are being met.
Yeah, and adding to that, I think one of the things that I've learned in my experience of providing care is that every family is different, and you can't, put a one size fit all approach to every family. And so the way that we do care at Brightline, we really customize it based off of what that family's specific needs are. Maybe and how those needs evolve over time. We may intervene for that child. We may provide a parent facing intervention if that's something that would be helpful for that family. And then, maybe down the line, it would be another child in that family that also needs that help. And we might provide a different parent facing intervention or a different intervention for the child. But the bottom line is like they can get their care all together at one place that is adapted and specific to what their needs are for that time.
Yeah, just the convenience factor of that alone, right? 'Cause, like, just being able to have one team that I could go to for all three of my kids who all have stuff going on. So that's huge, not to mention my own stuff. Um, Nikhil, you obviously have a ton of background in virtual care, not just at Brightline, but in your previous roles. And, we started providing virtual care about 6 years ago. I think we were frankly probably the first national platform providing virtual care for kids and teens and their parents. And yet, I think a lot of families still are skeptical that it works for therapy, especially for younger kids. So we'd just love to hear your perspectives on how do we know it works and what have you seen to be effective?
Yeah, this is an area of deep passion of mine, because I had a period of 5 years where I exclusively saw patients remotely, and there's a couple of different really key elements when we're thinking about providing care virtually. First is a question of access. 70% of U.S. counties have zero child psychiatrists, so virtual care means that people who live in one of those areas that doesn't have a child psychiatrist readily available, now suddenly they have access. In actually having provided this care for a couple years, I think there's even more advantageous elements of it that we don't talk about so much. So one example is, when I see a child in my office, that's them coming into my space, and that means they have to travel. That means that they maybe have to take time off of school, or the parents have to take time off of work. There's a process, and it kind of has elements of inconvenience depending on where you live. When a child is being seen at home, they the convenience element is definitely there. It's very easy for families to be able to access the care. But also from a clinical standpoint, there's kind of really interesting benefits that we get when we are working virtually. So I can see the child in their room. I can see them playing with their own toys. I can get clinically useful information about what does the home environment look like. And that's information that I'd never be able to get if they were coming into my office purely.
I think one of the nice things about Brightline is that it's not just that we have a technology that can be used for virtual appointments, but that there is an entire family engagement. Can you talk about how the Brightline digital interventions and the platform work as a way to supplement the care that you may be providing families either virtually or in person?
Yeah, I mean, I think we've talked a little bit about the benefit of having everything in one place. In the community, you have, maybe a therapist here and a psychiatrist there, and all the information is all over the place, and it's kind of hard to get all the different pieces talking with each other. At Brightline, we have our information is all together. We have our clinicians together. We have our digital tools and applications, content, all of these things in one place where a family can access them and understand their care and their care journey all in one place together.
And practically, what does that look like? What can families access through our technology, and how does that work for families?
Yeah, so we have lots of content around just basic information, which can be really, really powerful in understanding, what your child is experiencing or what interventions you can use as a parent to help them. I cannot be effective if all I'm doing is seeing a kid for 45 minutes or an hour, and all I'm doing is seeing a parent for that hour of the week. I can be effective, though, if I can send them homework and say, hey, do this thing this week and come and report back to me of how it went.
And getting back to that idea that maybe a parent has multiple kids or a kid and a teen enrolled in Brightline, being able to manage all of those interactions in the same place as a mom, I mean, I wish I'd had this when my kids were going through some of their treatments.